Hello, I'm Rachael Duffy. I'm also one of the research champions and I'm a domiciliary care manager. So a bit about me. I've been a domiciliary care manager for about 7 years. It's in a family-run business, so I've been involved with the business for a lot longer, starting off as a carer when I was at college and university. So I've seen all aspects of the job. Throughout my role, I've tried to get involved in research where I can. Dave's tried to get me involved in research where he can. Like I said, we worked together on a Falls Prevention Act with Manchester University. Also looking at delegated healthcare tasks was another research programme I got involved with, and dementia as well. So I really enjoyed that, but I was only ever involved as a participant, answering other people's questions that they thought were important. And then it never even occurred to me that I could be the one thinking of the important questions until Dave spoke to me about the research champion role, which he'd started 6 months prior to the next cohort being advertised for. It sounded amazing. I really missed university, and I'd always thought maybe there'd be some way I could get back into academia, but nothing had really fallen in the right way. And I think once you're in a full-time job, it's really hard to think beyond that. But I thought this was really exciting that I could do both. I could see if research was actually something I enjoyed or something that I was good at. And I could bridge that gap between sort of the academic side and research side of life and then real-world experience in social care, which I think is vital for shaping good quality research. So my research project is about exploring menopause knowledge and its workplace impact among social care staff. The reason I decided to look into this was, well, there was a lot of reasons. Just before starting as a research champion, we'd started to... The landscape of social care, I'm sure, as a lot of people know, has changed a lot in the last decade, I'd say. And we are now supporting... the average age, I'd say, of the people we're supporting has reduced a lot. So we're supporting a lot of people who are still menstruating. And it was through having conversations with some of my staff a month prior to starting as a research champion that it hadn't even occurred to someone, but my team, that the symptoms of the menopause could be something that could be affecting someone who we were supporting. All they could see were the official diagnoses that they had in their support plan, their learning difficulty, their mental health conditions, but hadn't considered a wider, more holistic approach. And I thought, that's no fault of... we've got really caring staff, but it's a lack of knowledge, and a lack of knowledge for themselves as well. And it reminded me... I've got a 3-year-old son, and when I was pregnant, I felt that there was so much going on in my body that I had no idea about. And it was only through educating myself that I actually found out what a contraction is, which when I asked my friends, none of them knew either, despite having, multiple children. And I didn't want to go into the next stage of life, the menopause, in the same way. And I thought, there's so many amazing women around me who are going in blindly a lot of the time, trying to deal with a really difficult job and the symptoms of the menopause. It's no wonder in social care we've got an issue with staff retention when we've got a predominantly female workforce who, on the whole, aren't really supported that well through this time of their life. So, sorry, I've sort of waffled on. I tend to waffle more when I get quite passionate about something, so sorry about that. But yeah, in a nutshell, that was why I wanted to focus on this. So, challenges. So initially, it was quite difficult because I didn't really have a lot of research knowledge or background, but the amazing support from Caroline and Alison really helped to, as you can probably tell from my talking as well, I do need reining in a little bit sometimes, and I can have sort of a lot of ideas. So it helped me to really focus and for it to really take direction. Successes, I'm currently waiting on approval from ethics around a survey which I'm going to disseminate to social care staff. Oh, whee! Also, networking has been huge. I've made so many contacts with so many amazing people that have taken me into so many different rooms. I've always felt welcome. I've always felt supportive. Even to a few weeks ago, I was at the Etihad lifting weights. You just never know where you're going to end up, and that's what I've absolutely loved about this journey. And I've got new professional communities. So many people are sharing resources with me. It's hopefully going to make a huge change for my organisation and more widely. Next steps are my survey will be being sent out, then I'll collate the results and present the findings. We're thinking in a creative way, which blows my mind and I think will be really exciting. And then I'm hoping to get a realistic and effective support package in place that can be rolled out in similar organisations who maybe are also time poor and don't really have a lot of funds to look into this themselves. And for myself, it's made me think about considering pursuing a PhD, if I could actually say it, maybe they'll accept me, and encouraging other people as well to get involved in research, which I'm trying to do through the next works I'm already in, because I didn't really know much about this, and if it wasn't for Dave, I wouldn't be where I am now. So I want to pass that on and hopefully help others to get involved and reap the benefits for us all. Thank you.